Right. Good evening, everyone. We all decided, well, I informed you, we didn't decide it. I informed you that we'll be discussing, or I will be discussing with you, the injuries of brachial plexus. I kind of gave you a little hint yesterday how or what are the injuries are called. And one importantly, the most commonly when the upper roots of the, just say root accidental tear of C5 and C6, root tears, they are involved, then it affects the shoulder joints abduction. It's totally lost. Why? Because you already know the muscles performing the abduction of the shoulder joint are the biceps, brachioradialis, and the deltoid. So basically, these three muscles get paralyzed or they lost their function. They lose their function forever. Other muscles which also can be affected are supraspinatus, infraspinatus, and supinator. These are also partially paralyzed, and this injury is called Erb's palsy. Let me show you. Right, I'll enlarge it. I'll share the screen first, and then I'll enlarge it. Otherwise, I'm not able to show you. Here you could see, I'm sure now you can see, this is the kind of picture that you get. And if this injury or this lesion involves the sympathetic chain as well, then it also leads to Horner syndrome, as you could see here. It affects the upper eyelids, and it causes ptosis, and pupil becomes smaller, leading to a syndrome called Horner syndrome. So as you could see in the image, the shoulder are rotated forward. Look here, shoulder are rotated forward, and the affected arm diminished in length and girth. See, it's more thinner and it's more malar as compared to the, if this is right, and then compared to the left one, right? So you can see the affectness, muscles atrophy of the affected arm. You could see the muscle atrophy there. There is also one point that you have to figure it out. It's called way to tip appearance or deformity of the affected wrist. What happens here? Another thing that you could see, there is cervical scoliosis and there is lumbar scoliosis. At the same time, you could see the winging of the scapula of the affected side. See how this should be the normal shape of the scapula or the blade of the scapula, but it's more like, it's called, because the muscles which are responsible for the abduction of the shoulder joint are or have been paralyzed. So that's kind of, it's giving you this kind of image. If you want me to repeat the muscles which have been paralyzed, so most commonly deltoid here, brachioradialis here, this one, and then biceps, giving the bulk to the, and then supraspinatus, infraspinatus, and spinator, which are responsible here for the scapula. So they're all damaged. And that's basically because of the Erb's palsy. It's called Erb's palsy, involving the sympathetic trunk, leading to Horner syndrome. And then if there is involvement, once more, the involvement looks like with the flexion of the wrist at the wrist joint, and that is leading to post-vegetative position, loss of shoulder abduction, deltoid and supraspinatus are paralyzed, loss of shoulder external rotation, infraspinatus and teres major are paralyzed, loss of elbow flexion. See, elbow cannot be flexed, it's just hanging by the side. So because of the paralysis of biceps, brachialis, and brachioradialis muscles. Loss of forearm spination because of biceps paralysis. So all of these are as a result of, Erb's palsy. More I could tell you, there are also upper brachial plexus injuries as a result of obstetrical or birth injuries, like when you are giving you when you as a physician or surgeon are giving or going through or forceps delivery or the vacuum extraction of the fetus, that also gives the injury of the Erb's palsy of the brachial plexus. So when there is cephalopelvic disproportion of the fetal head and the with the fetal head of the pelvis, or there is forceps delivery of the fetus or the vacuum extraction, or when there is head first delivery and you are not prepared, you as a physician are not prepared when there is breech delivery or there is forceful arm pulling. So all of these conditions can lead to Erb's paralysis. If I can, yeah, so that is one condition. I stop sharing this one and I'll tell you another condition that can also occur, and that is called Klumpke's palsy. Let me show you here. I'm sure you can see how the arm is. There is wasting of the forearm muscles. There is claw hand. It could be claw like this. You could see this is called Klumpke's paralysis. And but you have to remember that also occurs during the childbirth. When you have to remember this, whenever there is lower trunk C8 and T1 injured, the features would be just like I told you, involvement of C8 and T1. There'll be a claw hand, just like this one, and metacarpophalangeal joints will be extended. See, metacarpophalangeal joints are extended, and interphalangeal joints will be flexed. Interphalangeal joints are flexed. There'll be loss of sensation over medial aspect of the forearm, right? And hand as well. There'll also be presentation of Horner syndrome, and there'll be also, yes, loss of flexors of the wrist. As you could see, loss of flexors of the wrist. Let me show you or give you another example. What happens, yes, right. In that one also, there'll be low brachial plexus injury. Shock muscles of the hand are affected. It will give you a claw-like position, or it will be Benedict's palsy. It's also sometimes called Benedict's palsy. Yeah. So these are the differences. You can maybe look at this image here. I wonder if I can enlarge it. This is the Klumpke's. Also, you could see infant abducted arm is pulled away from the body. Here, when the body is like baby, you are pulling it out, or when there is a breech delivery here as well. So there's chances of lower trunk of the brachial plexus getting injured. Right, where is the image that I wanted to show you this? Wait, gosh, wait, just a second. Yeah, it's going to take me stop share from here and show you another image. Wait. Wait, I'm trying to enlarge the image and then show you. Let's see if I can. Right, it's a lot more clearer, but then again, I can't enlarge it. It's just this little. And here you could also see both deliveries and the mode of injury of the upper on one side and the lower brachial plexus injury. So maybe here, yeah, a lot better. You can see, giving you a reference on Pinterest. So if you're not following it, follow it. That's my opinion. You could see it here. I cannot save it because this is not my image, but I'm sharing it with you so you know where to find it. And you can see the difference very clearly given side by side. It's very important, you know. That's why I'm spending so much time and telling you, because you have to understand the difference in between these two, the mode of injury. A person is falling just like this on the shoulder with the neck extended to the side, whereas here in Klumpig's palsy, when you are falling down and you're reaching out for a branch or something, or yeah, so that reaching out will lead to lower brachial plexus injury, lower trunk of brachial plexus, CXT1. Whereas if you're falling directly like this with the neck extended in this position, this will lead to, or this will cause injury of the C5 and C6. Good. I'm sure it's clear. A lot of MCQs can come here because it's a lot confusing. It's more confusing than I've explained. I tried my best to break it down and see the neck and shoulder, how the traction injury, yeah, they are calling it traction injury. That's more better word to use. So that's the traction injury of upper C5 and C6. So I'm trying my best to give you as much explanation as possible so that you can understand. Understanding and knowing the difference is the only way to get you out of the confusing MCQs, because they can really blend the stems and they can make you really confused because both are in the arms. So you have to know the difference, how to not to confuse yourself and know the difference clearly. I've tried to show you some images as well in order to help you with the picture memory. The reason I'm not sharing MCQs that it's copyright. Either I get the time to write my own MCQs and then share those with you. Otherwise, I thought of giving you lectures so that you know only the topics that I'm covering in my discussions. MCQs come from these topics. So you have to know these topics in really, really good details. So all the best with your MRCS Part A preparation. And as I told you before, brachial plexus are very important even for Part B anatomy clinical examination. So once done properly, will come handy again and again. All the best. Bye-bye.